Good evening, students. Welcome back to our channel Ach'z. So today I'm here with the OET exam review. Yesterday, the first test date of 2025. So I thought of discussing about the complete review because many students requested to update. There is no any information about the first test date of the year. So many confusions, right? That's why I thought of discussing the question papers which are available from students from different countries. So we got questions from India, GCC, from Dubai, the Saudi and all, and also from some European countries. So I will mention different set of question paper. It's not about you will get all the set of question paper. So the available question papers based on the yesterday's exam only we are going to discuss. Okay, don't be confused by that also. And if you appeared for your exam in any part of the world and you are ready to share your experience, means try to comment about the question category or the topics which you got in your exam. So we are going to discuss about the WLRS section for OET section of 11th Jan 2025, the first date of the year. So let's start off with the section. So first of all, we will discuss about the reading module. That means usually I will just make some slides about the review and also today the first exam and the new year. So I thought of coming directly to discuss the things with you. Okay, so the reading module, the first set of question, it's about the coronary artery disease. So that's about the title, and the test A including the definition, test B with the symptoms. In that they mentioned about the pain areas, the gastrointestinal symptoms and also the other types. And coming towards test C, they got the causes like the genetic factors and the atherosclerosis like that they specified. And about the D, complication and the management. So that's about the first set of question. It's about coronary artery disease. So coming towards the second set of reading from GCC. So the reading test was about gallbladder stone, and the test A including the definition and the meaning, and test B about the signs and symptoms, test C about the treatment and also about the surgical management, and the D, the last test, is about the pharmacological management. And in that the C1 and C2 also we got, it's about the TB medication and also about the shared decision making. So that's about the C1 and C2. And the students reported that the writer's opinion oriented and the writer's attitude oriented questions were more, and they got some inference type of questions. So we already done some videos in our channel related to how to solve different type of questions. So you can just go through that, and it's available in our FB pages also. Now coming towards the third set of reading, it's about the ALS, amyotrophic lateral sclerosis, and previously also we got the same test. So it's the review from Singapore, the Canada and all, and the test A including the definition and types, and test B with the signs and symptoms and even the diagnostic evaluation, test C about the non-pharmacological management, and test D about the medication, that means pharmacological management. So in that the C1 and C2 including the pulmonary embolism and also about the insect bite. So that's about the three different set of question under reading module which we collected. Now coming towards the second module, we will discuss about the writing section. So in the first set of writing, you are a nurse at a boarding school. So one of the student came to you and complained about the hair loss and associated depression. So they just given the details about the patient, the date of birth, address, the social background, the present complaints, and even the treatment summary from 2014 until 2024 they just mentioned. And you need to write a letter to the senior nurse practitioner. So you need to mention the patient's history, your concerns in detail in your letter. So this is the first set of letter. Coming towards the second set of letter, it's an unknown case. It's about the home visit. You need to write a letter to the community health nurse. So the patient name they mentioned John with stomach cancer, surgery already completed, and the surgery was partial gastrectomy. So you need to write a letter to the community health nurse for requesting for the home visit for post-operative care. Okay, so that's about the second set of letter. So coming towards the third set of letter, so you are a nurse conducting a nurse home visit, and as a part of your routine follow-up, so after the patient's recent hospital discharge, so they just given the patient details, the social background, the medical history. So the medical history including hypertension, diabetics, type 2 diabetics mellitus, and also depression. So the family medical history including the mother with hypertension and DM, and the lifestyle including the smoking, alcohol, and the lack of exercise, and even the improper diet. So they just given the medication including metformin oral 500 mg twice a day, and quinapril 40 mg twice a day. So that's about the medication given. So they just given the hospital treatment record and also about the last nurse home visit. So in that they mentioned about the report of chest x-ray, throat swab, and echocardiogram including the pericarditis, the diagnosis with the pericarditis. So now you need to write a letter to the emergency department consultant on duty requesting the urgent assessment and the management for this pericarditis. So you need to include all the details in your letter. So that's about the three different set of question paper under writing section. Now we will move on to the speaking section. Coming towards the first role play card under speaking section, it's a non-case home visit. The patient already has bronchitis, so need to assess the progress. The patient is currently using an oxygen mask. Now he is switching to this nasal cannula. So the patient is concerned about the procedure and the use of this cannula and all. The talk including you need to advise the patient about the care of this cannula and explain the procedure, how to take care about this cannula, the use the cannula, and comfort him. That's about the first role play card. Coming towards the second role play card, the setting is hospital ward. The patient admitted for this congestive heart failure. Now the patient has leg and arm edema. So nurse need to ask the patient for the physical assessment, ask the permission to take the physical assessment. So the doctor recommended IV cannulation and diuretic administration. So you need to comfort the patient and explain about the procedure and seek out for the permission for this procedure and also for the assessment. So that's about the second role play card. And coming towards the third set of role play card, hospital ward, again the setting. Patient scheduled for surgery and complained on cannula site and severe pain. So you need to reassure the patient about all the concerns. So that's about the third role play card. Coming towards the fourth set of role play card, so the setting is patient's house. So the patient is diabetic and recently the doctor suggested to start insulin. So he is unsure about why it is required and about this injection, the concern about or worried about this taking the insulin injection and all. So the nurse need to explain about the importance of taking this injection and explain the details about the process of performing this insulin injection. And also the nurse need to explain about the importance of using these clean needles or to changing the syringe. Okay. And also about the administration, the general site for the injection, because he is taking the insulin first time. So about the site, which all are the site he can able to take the injection, what all are the things he want to take care about. So that's about the four different role play card. Coming towards the listening set, again we got three different sets. In the first set, the talk by ophthalmologist and also pediatrician, and in the second set, the talk by hematologist and also dermatologist, and in the third set, gynecologist and neurologist. So that's about the three different listening set. So I hope you got some idea about the topics which are relevant or they started to ask. Okay, so accordingly you can be familiar with the format or you can just select your practice materials. So all the very best for your upcoming exams, and those who already attended the test, I hope you all will get a good results. So thank you so much for your time over here, and we will update all the information about this OET exam. So if you are an OET aspirant, you can just watch out this space to get more information. Try to subscribe and click on the bell icon to get the notification. Then others can also recognize us. And if you think that our videos are helpful, try to share it to your friends, those who are planning to take the OET exam. So all the very best for your OET journey, and we will update all the information and also the review and the question paper discussion after each and every exams. So thank you so much for your time over here, and God bless you all.